Good afternoon, Dr. Berger.
Good afternoon, Irina.
Today's session, I would like to talk about open enrollment. Right now, a lot of companies going through open enrollment, which actually kicks in January 1st of 2026. And recent studies show that on average in corporate America, premiums are going to go up 6-7% minimum. I would like to talk today about FSA, HSA, and HRA. But before we kick off and speak about those programs, I would like to ask you, why do you think it's a great opportunity for concierge medicine to be combined with those traditional plans?
Right. I think a concierge-style practice like ours can really complement the insurance that I believe all patients should still maintain in case, God forbid, they need to be hospitalized or they need to utilize a specialist and so forth. But in a practice like ours, where we have a very small panel and we know our patients very well, we treat them like family. They have direct communication with us and they can get an appointment easily, and we spend plenty of time with them, so we know them really, really well. And because of that, we have the opportunity to often stay ahead of diseases, and so we may prevent the need for a specialist visit or an ER visit, for example. And we're very proactive about the health of our patients. So in this way, we can also stay ahead of the curve and prevent chronic metabolic diseases from developing, things like hypertension, hyperlipidemia, diabetes, obesity, and all the things that they can lead to, in particular with the heart and the brain. So I feel that investing in one's health in this way is really important, because just like saving for retirement, the more that you put in early, the better off you are decades down the road. So again, utilizing a practice like ours does not obviate the need for carrying insurance. I think for emergencies and so forth, everybody should have it, unless they're of the means where they're not concerned, in order to preserve themselves financially, but to preserve and maintain and improve their health. A practice like ours can really be a great investment.
And it's also great in terms of time utilization. Like, I know that we usually get people in the same day or the following, versus to wait for primary care appointment. People complaining it takes 3-4 weeks, sometimes even more. And also continuity of relationship, right? I mean, I can talk about my experience. I had primary care doctor. Every year I would have someone else, because people burn out and they basically leave the system. So this is somebody that really can manage your health, and from, coordinate your health with different types of specialists and really communicate and give you 100%.
Exactly. So you have a deep knowledge of human resources, and could you please speak to those different programs, what those acronyms mean, what our listeners would need to know?
Of course. HSA, HRA, FSA, it's all regulated by the government. IRS gives you X amount of money to do pre-tax. And a lot of patients, a lot of employees, they're taking advantage of those plans. I mean, they very much, they're different. You cannot participate in both plans, for example, FSA and HSA. Flexible spending account, it's use it or lose it. It's basically, you need to pre-calculate and pretty much say, okay, I go to a doctor X amount of times, visits, and I do lab work, and I have my copays, and you basically, pre-calculating, and you're putting aside certain amount of money. And again, if you're not utilizing at the end of the year, you're basically losing it. HRA, it's an HSA, health spending account. It's more tied up to, I would say, deductible plans. And employer tries to incentivize, and basically, if you're going through screenings, if you are losing weight, they can contribute and give you money toward your HSA account. The main difference between HRA and HSA, HSA, when you leave the company, you take this account with you. And again, you can, you can Google and you can take what IRS allows you. Usually it's over certain over-the-counter medication, also copays, also labs. If you're going to draw the blood, I mean, you just need to know what
and of
it's
course
eligible
membership
for.
fees in
Right.
practice such as ours.
Right, membership fees we do accept, and people definitely can, put this towards the concierge membership fees. And HRA, again, if you are leaving the company, it's employer sponsored. If you leaving the company, you're basically losing it. Those are the major differences. And again, from year to year, the amount is being increased and what it's allowed by IRS. And yeah, I mean, it's a perfect way of getting such beautiful healthcare and taking because our practice, it's not only once a year practice. We're not only doing blood work and that's it. We have so many. The primary goal is optimization of our health, and optimization. It's not only curing if you're not feeling well. It's basically taking care of you and making sure when you get older, you're not only living longer, but you're also having a phenomenal health span, and you're strong and you can perform all your daily activities. And in order, it's like a deposit. If you're depositing every month a certain amount of money, when you're retiring, you're becoming wealthy and you don't have to worry about that. The same thing with the health. If you're working out, if you're eating properly, and I think the practice teaches patient how to do and constantly reinforces, because life gets on the way and people are so stressed out with everything what's happening. They're not prioritizing themselves, and it's all about work, and it's all about especially what's happening right now in the world. I think it's very hard to think about your health, all the pillars of
I agree.
health.
I agree. And also for people with a high deductible plan who go to, say, a primary care physician who doesn't have a concierge style practice like ours, and they have to pay every time they go, it often discourages people from taking care of their health. And patients can come and see us as often as they need to. They already know how much they are investing in their health with our practice, so there aren't surprises. And I think this can really remove that barrier of thinking about you're going to get some unknown surprise bill if you go see the physician, so you put things off.
Absolutely. You have basically unlimited access to us, and you having health coach that you work on a weekly basis. You have exercise physiologists who doing customized plan for you, and you can revisit and reach out to him anytime you want. Like, we have patients who come to us on a weekly basis and they want to just follow up on certain things with you. It's really totally different level. If something happens in the hospital, like this week, somebody ended up in the hospital, how long did it take you to go and visit them?
In 10 minutes, I was there to see the patient after a surgery. Yeah, I think it's a really great way for people to invest in their health and make sure that when they get to their older years, they're in really good shape.
Yeah, there is a stereotype that concierge medicine it's only for wealthy people, but I think it's anybody can afford us. Like, life is very expensive, right? I mean, but if you divide everything what we're doing, but the amount of services we provide, it's really great value.
I agree. Well, thank you for taking the time to enlighten our patients about
Of course. Thank
these
you, Dr. Berger.
different types of pre-tax healthcare dollar programs. Remember, of course, that we are a medical practice. We are not tax or financial advisors. We're not experts in that way, and this does not constitute any kind of tax or financial advice. Please reach out to your experts in those fields, as well as the human resources and benefits managers at your employer, if appropriate, to help determine what might be best for you. in terms of how to move forward with your health. But if you'd like to reach out to us, learn more about our practice, we are Northeast Medical Practice in Great Neck. I'm Dr. William Berger and Irina Berger.
I'm Irina Berger.
And we are at 516-604-3418, online at northeastmedicalpractice.com, through our social media channels, our YouTube channel, and you can learn more about how to optimize your health on my podcast, LongevityMD, on Spotify. But until we see each other next time, be in good health.
Be in good health. Thank you.